So I want to obviously do some Q&A. Pretty much everything was covered about my background, and I'll give it to you from my perspective. In March of 2016, my primary care physician had noticed I dropped a lot of weight, and I had this cough, and I was a smoker. And I was a hardcore smoker. Not so much the amount, but the length that I smoked. And I was one of those kids affected by all the TV shows and movies with Sinatra and Humphrey Bogart and the Beatles later on. Everyone smoked. I wanted to smoke. And I used to pick them up off the street and start smoking before I became an official, I'm old enough to smoke kind of person. So I smoked for a long time, and I'd quit before I got diagnosed just because I was done with smoking. It bored me. Didn't need it anymore. There's obviously a very strong percentage factor that's the reason I have this. But some oncologists have said to me, we can't guarantee that you have lung cancer because you were a smoker. Just a thought to be interesting, to put in the back of your mind. Does not mean I want you guys to pick up smoking. Just means there's not a guarantee that it's from smoking. So March 2016, I go get a lung x-ray. And I'm like, I'm not even worried about it. I don't know why. Should have been, right? But when I was there, the guy says, don't go anywhere. Your doctor just authorized a CAT scan. I never had a CAT scan after lung x-rays. Got the CAT scan. No one said a word to me. Thank you, sir. We'll talk to you. We're giving your results to your primary care physician. Bye. On the way to my work that day, the doctor calls me and says, don't even think about going to your job. You see me now. That's when my blood turned cold, the way she said it. Went to see her, and when I walked in the door, the first words out of her mouth, but diplomatically, she's very good with patient care, was, I don't have the world's greatest news for you, and I knew right away I had a problem. So to fast forward, she gave me some names of people in oncology, both a thoracic cardiosurgeon and I guess a regular oncologist, and they weren't available for whatever reason. So I contacted two musician buddies of mine who are both affiliated with NYU Langone, and they gave me their contacts, a thoracic cardiosurgeon as well as what ended up becoming Dr. Shoshua, who anybody who's involved with cancer care here might know who he is. So they said, we're going to do an exploratory surgery. It involves a bronchoscopy. I'm very bad with the names. Medianoscopy. And a third one, which I can't pronounce. And I came out with a lung drain tube and the big talk when they come to me the next day and they go, you have non-small cell lung cancer. That didn't mean anything to me. I mean, the lung cancer did, but not the non-small cell. So what does that mean? Non-small cell is less aggressive. It moves slower. With small cell moves very aggressively, and unfortunately, that's what Christopher Reeve's wife had, and Peter Jennings from ABC News. And as you know, they didn't last very long. So I get the exploratory surgery, and obviously, in discussing this, and for some insane reason, I decided to be macho, and I go to the doctor and I go, okay, give me the stage number, just like this, and give me how long I got left. And the guy looks at me with horror. He goes, I'm not going to give you either one. I view your situation as being treatable. That was kind of uplifting to hear that. So they still have me to give me, the stage probably comes from the way it metastasizes too. So after the lung drain, and I was in the hospital at what was then called Lutheran, I think now it's NYU Langone, Brooklyn. While my lung was being drained, I also was sent for other tests to see if anything had spread in the business. They call it metastasizing. And I had metastasizing to my pelvis, over here, my scapula, I think over here somewhere, and my brain. A little scary. So quickly, I was assigned to be under the auspices of Dr. Abraham Shoshua, and the first thing he said was, let's get the brain thing looked at first. So I had a procedure under Dr. Konziolka called Gamma Knife. It's as science fiction you're ever going to see. I literally wore my Superman shirt to get the work done, with a helmet with a bunch of spikes sticking out of my head. If you're going to do this, try to have some fun. It'll make a difference in results. So while I'm pretending to be Superman and getting my brain drained, the good news was that was 2 years in April of 2016. Nothing's come back in my brain. My brain is totally clear. Okay? I then went on to what was called, I'm just kind of skipping it so I give room to the other people, targeted treatment. Initially, I was going to go for regular chemo, the kind with the injection and the needle. I have what's called pill therapy. The first thing is targeted treatment. The particular medicine was called Tarceva, which was great. Tarceva started beating up the bad guys, and After a relatively decent, not too long, but not too short period of time, the metastasizing of my pelvis and scapula totally clear. So no cancer, brain, shoulders, or hips, gone. Now, what happened was a new genetic mutation showed up and goes, I don't care what you take it, I'm going to attack you another way. So I went into clinical trial briefly to try to find a way to beat the new mutation, which is called, and feel free to jump in if you guys are in oncology, T79. After I was EGFR initially, and now you're EGFR, you keep your original mutation, then they add ones to it. So I was EGFR T79, and to make a long story longer, the clinical trial was great. The cancer in my lung, which is the only place I had it left, was being beaten up severely in a good way, but I picked up a side effect affecting my heart efficiency called the ejection fraction. It's supposed to be between 50 and 70. Mine was 60, it went down to 40. I'm on medication to bring it back up and on half dosages of my newest targeted treatment called Tagresso. Since I've been on Tagresso, what's left of whatever tumors I have in my lung has been reduced by 65%. Now, I should point out to you, although I can't do my day job right now, which involves moving packages and suitcases, I'm drumming in 3 different bands. I work out 3 times a week. I bicycle 2 to 3 times a week during the warm weather. I look decent for a man of 65 facing this. So, and I'm not trying to do like, oh, isn't this guy cool? But to give you guys hope. And if you're going to get this horrible disease, and I hope you don't, but get it now instead of 10 years ago. And since we can't go back in time, you are going to get it now if you're going to get it at all. So, any questions? Don't be shy. Oh, that was offered as a possibility when they were explaining that the Tarceva had lost its effectiveness. And I basically went to, I forget who I spoke to. I said, what would you do? I figured, let me just go to the guy who's offering this. Would you do it? Yep, that's all I need to know. Put me on. And then I was also given a lot of testing for that. I saw an eye doctor. I did a liquid biopsy, a tissue biopsy, some other biopsy, I forget what, or some sort of a further test, maybe a psychological test, who knows. No, I would have failed that. I definitely didn't do that. So, and then I was referred to the clinical trial, which worked great. And as far as beating up the cancer, it still is great. Just that there were some side effects involving heart efficiency. So the oncology team at Perlmutter, I can never say that name, the Cancer Center on East 34th Street, referred me to a great cardiologist here at Tisch, Dr. William Cole, I believe his name is. And I'm on medication that's more or less at least calmed down the heart inefficiency. I feel great. And now I'm on this new targeted medication without the clinical trial supplements. I was yanked off that once my heart became less efficient. So, any further questions? You guys are good. No questions? Okay. Thanks very much, folks.